Today we'll talk about one of the main symptoms of peripheral vascular disease, which is tissue loss or ulcers. Ulcers might be acute or chronic, and we define ulcer as discontinuity of lining or covering epithelium. So remember that ulcer can happen on the skin or mucous membranes. By definition, chronic ulcer is the ulcer which doesn't heal in 4 weeks or 1 month time. Usually for any ulcer to heal, it needs good arterial blood supply. So in patients with peripheral vascular disease, they might not have enough blood supply if they got an ulcer to heal it. And according to the scientific definition of ulcer, gangrene is an ulcer, because gangrene is death of part of the tissues, the toes or part of the foot or the hand or the fingers. And when this happens, actually there is discontinuity of the covering epithelium in this area, in the gangrenous area. So by definition, gangrene or ulcer are both tissue loss, and they indicate as well threatened limb ischemia, and this patient usually would need some sort of intervention to correct his circulation and will not be managed only with medical treatment, except in very few exceptions. So we will discuss now how to take history about the tissue loss or ulcer. The patient of peripheral vascular disease, when they get spontaneous ulcer, it's the same like rest pain. It's expected to be in the farmost point from the heart, which is the tips of the toes. The second most common type is between the toes, because between the toes there will be sweating, there will be water, and there will be maceration of the skin between the toes. And because the patient doesn't have good arterial blood supply, so the renewal of the skin that get macerated in these areas will not get renewed, and the patient will get ulcers between the toes. You have to remember during inspection and examination to separate the toes, to look between them, because if the patient has an ulcer there and he is diabetic and he doesn't feel any pain, he might not feel that he has an ulcer, he might not know that he has an ulcer. So to analyze the ulcer by history taking, you have to ask the patient about the site of the ulcer, the onset and duration, the cause of the ulcer the patient thinks caused the ulcer, if there is any discharge, and the color of the discharge, the amount of discharge, the odor of the discharge, the skin surrounding, if there is any redness, hotness, tenderness, if there is pain in the ulcer, and if there are other generalized symptoms like fever, tachycardia, palpitation. The patient might feel drowsy, if he lost appetite, night sweating, other symptoms that might indicate the patient has some sort of septicemia. So as we have mentioned, the typical site of gangrene or tissue loss or ulcers in peripheral vascular disease are the tips of the toes. But there is a rule in life and medicine that stress uncovers hidden problem. So if the patient got trauma to the dorsum or the plantar aspect of the foot or even the shin of the tibia, and the amount of blood supply needed to heal this traumatic ulcer is not enough because of peripheral vascular disease, then the patient will develop an arterial ulcer in a typical site. And we will mention in examination how to examine and what are the characteristics of ischemic ulcers. And in medicine, there is no black and white. So you have to understand that actually if the patient has a small ulcer and he has mild peripheral vascular disease and he has good collateral circulation, this ulcer might heal, because it all depends on the size of the ulcer, the depth of the ulcer, if there is any accompanying infection or not, if there is any tissue destructed, if there is a fracture, the immunity of the patient, the virulence of organisms, if there is any infection in the ulcer. So it is an equation. So at the end of the day, some patients who has peripheral vascular disease might heal by themselves, depending on how much arterial blood supply this ulcer need to be healed, and if the arterial circulation of this patient can deliver this amount of blood or not. If the patient has gangrene, you have to ask the patient about if this gangrene is dry or moist, if there is any discharge coming out of it or not. Usually the ischemic ulcers are painful, but in some patients with severe peripheral neuropathy, especially diabetics, they might not feel any pain in their toes. Even if they get a fracture in their foot or their toes, they might not feel it. So we cannot depend on the pain to diagnose the peripheral vascular disease ulcers or the ischemic ulcers in these patients. In the next videos, we'll talk more about the past medical history, past surgical history, the history of present illness, and the other items of history taking in peripheral vascular disease patients.